The evidence around the use of masks by the general public, especially outdoors, is extremely weak.
We do not recommend face masks for general wearing.
The evidence on face masks has always been quite variable, quite weak.
The evidence is weak and the effect is small.
Face coverings will become mandatory.
In terms of wearing a mask, our advice is clear that wearing a mask if you don't have an infection really reduces the risk, almost not at all. So we do not advise that.
And wearing of face masks by the general public. This has been a controversial area in pandemic preparedness and planning for the 15 years that I've been involved in it. And indeed, I was on the phone this morning to a colleague in Hong Kong who's a professor there, who's done the evidence review for the World Health Organization on face masks. And we're of the same mind that there is no evidence that general wearing of face masks by the public who are well affects the spread of the disease in our society. But in terms of the hard evidence and what the UK government recommends, we do not recommend face masks for general wearing by the public.
The evidence on face masks has always been quite variable, quite weak, quite difficult to know exactly, and there's no real trials on it. And we've undertaken a review. We'll give our advice to ministers and they'll make decisions about what to do around that.
When the evidence around the use of masks by the general public, especially outdoors, is extremely weak.
So we haven't got enough top-end masks. Is that what I take from that?
That's not how I'm putting it. It's that we've got to make sure that they're prioritised, but also you've got to follow the evidence in terms of how effective mask wearing is.
On face masks, we are guided by the science, and the government position hasn't changed. Professor McLean will explain the science. The government position, the UK government position, hasn't changed. Not least because the most important thing people can do is the social distancing.
Right now in the United States, people should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often, there are unintended consequences. People keep fiddling with the mask and they keep touching their face.